Hi, Dr. Ericka Craft Mizuta here. So we're talking about 6 things that you can do that have been fully researched that will reduce your risk of heart disease by 90 to 95%. That's huge. And each individual thing, there is a percentage, if you do it, of how much it's going to reduce your risk. So I will link the study at the end, so if you wanted to go look at it, you could. But the study is actually called the Chicago Heart Association Detection Project and Industry. And this is a study that was done on 6 items, and if you change those, how much does it reduce your risk of actual heart disease? So in combination, if you do all 6, you reduce the risk by 90 to 95%. That's huge. So the first one is that if you decrease your cholesterol, your total cholesterol, by 50%, then you will have a 50% reduction in heart disease. So that's a big one. 50% decrease in heart disease is a 50% decrease in your risk of heart disease. The second one is decreasing blood pressure, and specifically the diastolic blood pressure. So that's the pressure reading when you take your blood pressure on a monitor and 120/80, less than that is considered normal. The diastolic pressure is the second reading. If you can decrease that by 6 millimeters in diastolic pressure, so meaning, say you take a blood pressure and it's routinely 126/80. If you could reduce that to 120/80, that is a 42%. So it's a 16% reduction in risk of heart disease. But in terms of stroke, it will reduce your stroke risk by 42%. That's also huge. That's not a very, that's a small number actually. You can do that easily just by watching what you're eating, not eating so much salt, and actually going out and working out a little bit. Okay, the third one, to reduce your heart risk disease by 90 to 95% is to stop smoking. Again, this is a huge one. If you stop smoking, it's a 50% reduction, 50% risk of reduction in sudden heart attack. Third one, I think this is the harder one for most Americans, is to maintain an ideal body weight and waist size. So if you're a normal body weight and a normal waist size, that will give you a 35 to 55% reduction in the risk of heart disease. Fourth one, so if you do greater than 150 minutes of moderate exercise a week, and moderate exercise is not strolling along, walking your dog, talking on the phone. It's walking your dog, up and down some hills, maybe where you're getting a little bit out of breath and you can't talk on the phone. It's any activity that you're really not going to hold a conversation with somebody when you're doing it. But if you do that for greater than 150 minutes, that's also a 35 to 55% reduced risk of heart disease. And then the last one is to eat greater than 5 servings of fruits and vegetables per day, which has been proven to give you a 20 to 25% reduced risk of heart disease. So if you do all of those in combination, all 6 of them, you reduce your risk of heart disease by 90 to 95%, meaning that you're not going to be that 1 in 4 statistic, which is huge. So just to recap, the things that you need to work on in order to reduce that risk of heart disease by 90 to 95% are decreasing your cholesterol by 50%, decreasing your diastolic blood pressure by 6 millimeters, stop smoking, get to a normal body weight and also waist size, work out for at least 150 minutes per week with moderate exercise, and then also every single day eat greater than 5 servings of fruits and vegetables. So try those. And if you have a family history or if you've been struggling with any heart-related issues, so we can talk more about how to meet each one of those goals, but that's the big framework. If you do those 6 things, then you will reduce your risk.